everyone! Welcome to this channel. If you're new here, make sure to hit that subscribe button and turn on notifications so you don't miss out on our weekly content on health and health-related issues. Today, we're diving deep into a topic that affects millions worldwide: hypertension, also known as high blood pressure. It's often called the silent killer because it creeps up without warning signs and can lead to serious health complications. But did you know that there are 5 major risk factors for hypertension? Well, stick around because we're going to break them down one by one. Let's get started. 1. Poor diet. Alright, let's talk about poor diet, one of the leading causes of hypertension. What we eat directly impacts our blood pressure. A diet high in sodium, unhealthy fats, and processed foods can increase blood pressure levels over time. Most of us consume way too much sodium, which causes the body to retain excess fluid. This increases the volume of blood flowing through your arteries, leading to higher pressure. The recommended sodium intake is less than 2,300 milligrams per day, but many people consume over 3,400 milligrams daily. That's nearly 50% more than what's recommended. So what can you do? Reduce salt intake, eat fresh fruits and vegetables, choose whole grains, and include potassium-rich foods like bananas and spinach to counteract sodium's effects. 2. Lack of physical activity. Now, let's talk about the importance of staying active. In today's digital world, many of us spend hours sitting at desks, watching TV, or scrolling on our phones. A sedentary lifestyle is a major risk factor for hypertension. Physical inactivity leads to weight gain, weaker heart muscles, and increased stress levels, all of which contribute to high blood pressure. But the good news: you don't need to become a marathon runner. Even 30 minutes of moderate exercise like walking, jogging, or yoga 5 times a week can help lower your blood pressure. 3. Stress and mental health. Next up, stress. We all deal with stress, but chronic stress is a major contributor to hypertension. When we're stressed, our body releases hormones like cortisol and adrenaline, which increase heart rate and constrict blood vessels. While short-term stress is normal, chronic stress can permanently elevate blood pressure and even increase the risk of heart disease. So, how can we manage stress? Exercise, meditation, deep breathing, and maintaining a healthy work-life balance can significantly lower stress levels. Also, don't hesitate to talk to a professional if you're feeling overwhelmed. Mental health matters. 4. Smoking and alcohol. Now, let's talk about 2 habits that increase the risk of hypertension: smoking and excessive alcohol consumption. Smoking causes immediate spikes in blood pressure because nicotine constricts blood vessels. Over time, it leads to permanent arterial damage. Alcohol, on the other hand, raises blood pressure and can lead to weight gain, another risk factor for hypertension. The recommended limit: no more than 1 drink per day for women and 2 for men. 5. Genetics and age. Last but not least, something we can't control: genetics and age. If you have a family history of hypertension, you're at a higher risk of developing it. And as we age, our arteries naturally become less flexible, leading to increased blood pressure. That's why regular checkups are essential. Even though we can't change our genetics or age, we can take steps to manage our lifestyle choices and keep blood pressure under control. Alright, let's do a quick recap of the 5 main risk factors for hypertension. 1. Poor diet. 2. Lack of physical activity. 3. Stress and mental health. 4. Smoking and alcohol. 5. Genetics and age. If you want to keep your blood pressure in check, focus on eating healthy, staying active, managing stress, avoiding smoking and excessive alcohol, and keeping up with regular health checkups. If you found this video helpful, don't forget to like, subscribe, and share with someone who might need this information. Also, drop a comment below. What steps are you taking to manage your blood pressure? Let's start a conversation. Thanks for tuning in, and I'll see you in the next one. Stay healthy and take care.